In the inpatient setting, anxiety can either be primary or secondary to another condition, such as substance use. Patients with personality disorders can also experience anxiety, and they may not have the coping skills necessary to handle the anxiety, which can lead patients to engage in impulsive behaviors. Patients may also have a mixture of acute and chronic anxiety that is uncontrollable. Overall, the goal of anxiety treatment is a little bit different than that of depression treatment. With depression, the long-term end goal is remission. However, with anxiety, the goal is improved tolerability. With severe anxiety, the goal is to get the patient stable enough to be able to work on barriers effectively in therapy. Make sure to also communicate the treatment expectations to the patient. Improved tolerability means increased general resilience to stress with a combination of medications and coping skills, not necessarily fixing all of their stress. Patients should be educated on this so that they can remain realistic and understand the goals of treatment.
It's important to understand how treatment for a primary anxiety disorder works. SSRIs and SNRIs are typically first-line treatment for chronic anxiety disorders such as generalized anxiety disorder and social anxiety disorder. As with major depressive disorder, results are not immediate. In fact, it may take longer for patients to note positive effects on anxiety versus depressed mood with these medications. Also, the dosing of these medications may vary slightly compared to treatment of major depressive disorder. You might end up using higher doses to treat anxiety disorders. Although benzodiazepines are not typically recommended due to their short-term effects and risk of dependency, you may see these used on an as-needed short-term basis in certain severe cases of anxiety. However, you may want to avoid ordering benzodiazepines as scheduled medications, educate the patient on the risk of a dependency, and to take them only in cases of severe, uncontrollable anxiety. When starting out, make sure to check with your attending physician before ordering any medications.
As you might notice, this medication table looks very similar to the medication table in the depression treatment video. However, there are some differences. For example, only certain SSRIs and SNRIs have been FDA approved for treatment of certain anxiety disorders, such as generalized anxiety disorder. Other SSRIs and tricyclic antidepressants not listed here are also used off-label to treat anxiety disorders, and randomized clinical trials have demonstrated benefit of some of the non-FDA approved SSRIs to treat anxiety disorders. Randomized clinical trials have also shown benefit of SNRIs for panic disorder. As discussed in the depression treatment video, SNRIs may increase anxiety temporarily in some patients due to its potential activating effect with norepinephrine.
Although starting an SSRI or SNRI may help a patient's anxiety in the long term, these medications can take months for the full effects to be seen. Especially in the inpatient setting, it's important to consider some other medications that can help manage a patient's acute anxiety. The medications in this table are some options you might order for a patient, either as a scheduled or as needed medication.
Patients with psychotic disorders, such as schizophrenia, can also experience increased anxiety. In this case, the anxiety may be directly related to the patient's delusions or hallucinations. For example, it's easy to see why someone would be anxious if they were paranoid that someone was hiding in the walls with a knife and waiting to eat them. In situations like this, it's important to initiate treatment for the patient's primary psychotic condition and treat the anxiety in the meantime with as-needed medications.